I'm here at the scene of the accident. I'm wearing my BSI. The weather is clear. I see one patient about 60 feet thrown from a car. I don't see any other patients, nor do I see any bystanders to take sample history from. I'm now going to ask one of my partners to apply cervical stabilization, and I'm going to see if I can elicit a response. Sir, can you hear me? There's no response to verbal stimuli. I'm going to squeeze the earlobes, Teese, and there's no response to pain stimuli. The patient seems to be unconscious. I'm going to ask for immediate transport and ask my second partner to get me a longboard. Next, we're going to check for the patent airway as well as breathing. I will apply a modified jaw thrust, look inside the mouth, see if any suction is needing. I'm going to look, listen, and feel. I see the chest rise. Do I have a breath rate? It's rapid and weak. So I'm going to now apply a oropharyngeal airway as well as a back valve mask to bring down the rate of the breathing with 15 liters per minute of oxygen at full 100% oxygen. Next, we're going to check for bleeding behind the neck. Before that, let's check the pulse. Do I have a pulse? Carotid pulse is rapid and weak. Radiant pulse is also rapid and weak at about 120. So now we're going to check for bleeding behind the neck, behind the shoulders, upper and lower torso, hips, right leg, left leg, right arm, left arm. Okay. At this point, my partner is back with a longboard. We're going to roll him onto the longboard on the count of 3. 1, 2, 3. While he's on his side, I'm going to check behind. Check for deformities, bleeding, contusions. Now we're going to roll him back into the longboard. 1, 2, 3. We're going to strap him in. Click, click, click. Transport him into first onto the gurney and then into the ambulance. Inside the ambulance, I'm going to do a much more detailed assessment. I'm going to start at the head, look for the deformities, forehead, orbitals, nasal bone, mandible, maxilla. I'm going to look for JVD as well as tracheal distension. I'm also going to check his eyes. See what kind of response I get to the lights. If they're pearl, I'm going to look inside the ears and behind the ears to see if there's any fluids, any kind of battle signs, as well as below the eyes. Looking behind the neck for deformities. Now I'm going to check the clavicles, scapula, press the shoulders together, and check the chest. First the sternum. I'm going to check for equal distension, equal rise of the chest, to check his breathing. I'm now going to listen to his lungs. Laterally, sides, see what the lung sounds are like. Next, I'm going to Check the abdomen, all 4 quadrants. Look for guarding, distension. See if there's any wincing. I'm going to press the hips together. I'm also going to check the peritoneal rear side. Press the hips together and inspect the legs to see if there's any fractures, in addition to bruising or bleeding, which there is none. I'm now going to check the tibial pulse, the pedal pulse. I'm asking the patient to push against my hand, pull up against my hand, check the reflex, check for any kind of medical alert tags, and move on to the other leg to see if there's any kind of fracture or deformities, any unequal size between the 2 legs. Again, checking the tibial pulse, pedal pulse, pull up against my hand, push against my hand, pull up, check the reflex, any medical alert tags. Now moving on to the right arm, in-depth examination. Radial pulse is present. I'm also going to check for the capillary refill. First on the toes, make sure it's under 2 seconds. Do it with a thumb as well. Sir, can you squeeze my hand? There's no response. Can you wiggle your fingers? Check for tenting and for medical alert tags. Moving on to the other arm. Checking the pulse. Checking capillary refill. Sir, can you squeeze my hands? No response. Can you wiggle your finger? No response. Check for tenting and medical alert tags. Now we're going to check the vitals. Check the blood pressure. I got 110/72. I'm also going to check for the glucose level as well as the SpO2. And I'm going to do a reassessment every 5 minutes since it's an unstable patient. And I'm also going to ask for paramedic to meet us en route to do further tests and possibly apply medication to help the patient along with pain and revitalizing him. That's it.